I would guess over the last 45 years, we've probably had 600 to 700 students go through our program. When I first started out in respiratory care, it was called inhalation therapy. And I worked as an OJT, or on-the-job trained technician. There was no evidence-based medicine. We were all doing just what we thought we should do because that's what everybody else throughout the nation was doing too. As evidence-based medicine grew, the need for greater education grew, and we had our programs go from OJT to an associate degree, eventually a bachelor's degree, and then even master's degree, which Boise State has.
It started out very small with only a few students, few means 5 to 6 students, in which I spent a lot of time taking potential students to lunch, trying to interest them in respiratory care and the chance to be with patients and to spend time in a patient room, which is one of the most enjoyable parts.
I learned early on in my career, even as an intern and a resident, how important respiratory therapists are in providing optimal care for our patients.
I think we started with 4 to 8 students in our very first cohort, and now we've created a program that allows for any working respiratory therapist with an associate degree who's looking forward towards getting their baccalaureate degree, and that services 400 plus students across the nation now. So it's gotten much, much bigger.
The culture of care that was established, right, by the people who founded the program and then fostered the program over the past 50 years, that just really resonated with me as a student. And so when I had the opportunity to come on as a faculty, it was really important to continue that culture of care and put the students at the center of everything that we did.
I think a lot of what has contributed to the longevity of our program is really the people who have grown us. When I think about the program, I think about Lonnie Ashworth, Jeff Anderson, and Jody Lester, who grew so many faculty who still teach in our program. Additionally, I think our wonderful clinical partners who've partnered with us for the last 50 years have really helped to strengthen our students and our programming.
I think the community of respiratory care here at Boise State has always been one of kind of a love for one another, and that we treat people the way we would like to be treated. We model that behavior throughout our interactions with our peers, the interactions we have with students, with the end goal of we want our graduates to treat the patients they work with the most caring approach. And I think that really just transcends all the aspects of the respiratory care department.
Something I'd hope to see the profession accomplish in the future is advocating for allowing RTs to work to the top of their license, like intubation, ECMO, doing vascular access, really pushing the boundaries of what people think an RT is, respiratory therapist, in the hospital setting, and being more included in the interdisciplinary team as far as creating protocols and working together and having a larger voice within the hospital for patient care.
Yeah, I think the future is bright for respiratory care. I mean, I think the pandemic really opened a lot of people's eyes to the importance of respiratory care. I think there's a lot of potential for growth in respiratory care, and though I'm not certain exactly what that's going to entail, I know that respiratory care practitioners will be heavily relied upon for care of patients in our communities going forward, and I'm certain that Boise State will lead that progress.
What would I say to this generation of respiratory therapists is keep asking questions. Right? There is no end to what this profession can do. We are the experts in cardiopulmonary care.
More than anything, the advice I would give is to be really proud of the degree you've chosen. Whether you chose it or it chose you or you found it in one way or the other, really carry the pride of the knowledge and expertise you bring to a situation and know the value of your degree in respiratory care.